So I've been asked in the next sort of half hour or so to talk about the story so far. I didn't read the brief properly because I also ended up with the next 10 years, and I see this actually later in the day, but I'll give it a sort of give it a go sort of twice if you like. And I'm going to ask you to sort of play a little game with me and to sort of count or have a sweepstake for how many times I say thank you to various people during the course of today. And I really want to sort of start off by saying, for the first time, and I'm sure I'll say it multiple times, a huge thank you to the Alzheimer Society. I mean, you know, as Catherine mentioned, you know, we first met over 10 years ago when she just started working at the Alzheimer Society. And there's other people. I don't know if James Pickett's here. Is James here?
He's coming later.
Oh, he's coming later. But it was an incredible sort of moment, if you like, when we were, and I'll talk about this in the course of the next 10, 15 minutes or so. In some ways, the boldness and the bravery of the Alzheimer's Society to back dementia prevention. I'll talk a little bit, like I said, about where the world was 10 years ago and its perception of Alzheimer's disease and neurodegenerative conditions. But it goes without saying, and it goes with a lot of gratitude for the Alzheimer's Society to invest in us, to take a punt with us. And here we are 10 years later with a lot to celebrate over that course of time. So happy birthday to us. I won't ask you to all sing it along with me. Maybe by the end we'll sing happy birthday, who knows? Does anyone know where this is? Because this is where Prevent was actually born. Is Karen here yet? She's not coming. That's our name on the list. Okay. So this is the Place des Vosges in Paris. And some of you know that the co-principal investigator of this project is my close friend of many of ours, and namesake Professor Karen Ritchie. People always ask if we're related, but she was actually born in Tasmania and I was born in Aberdeen, so I don't think we could be further apart in the planet from where we're both from. But this is a Place des Vosges in Paris, where Karen and I had a coffee one afternoon, probably in sort of the spring of 2012 or something, and actually started to reflect upon where we were as a field in terms of understanding Alzheimer's disease and what we could or should be doing, if you like, to paradigm shift or to change the narrative and all these sorts of cliches that people use. And Karen's background is as an epidemiologist, and she ran a study called the 3C studies, 3-city study, based in France. And they recruited people into that cohort study over the age of 65. And they were learning a lot about aging and about the influence of different risk factors on developing dementia in later life. And what we reflected upon was that the observations that they were making in studies like that was that there was a lot going on before people hit the age of 65 in terms of their illnesses. And that's the reason why, in many ways, we said we need to go earlier. And that's where we put together the ideas, scribbled down on the back of paper, got involved people like John O'Brien and others are here today, and put together the grant application that went to the Alzheimer's Society. Now, this cartoon, this figure, I apologize to people who've seen this 1,000 times before in talks I've given, but this cartoon is almost as old as the project itself. But as you can imagine, one of the things as you develop a project like this over the years is to try and avoid mission creep, because there's so many things that we could do with the energy and the enthusiasm and the intellect that comes to bear on the project from many of the amazing academics and researchers. But in that 10-year period, it's really important to stay true to the purpose of the project. And what this cartoon or series of cartoons demonstrates, if you like, is the clinical stroke academic foundation of Prevent. And that is that still to this day, but changing, we tend to think of neurodegenerative diseases like Alzheimer's disease as a disease of older people who have expressed symptoms like memory impairment, functional impairment, behavioral changes, etc. But we hypothesized at the beginning of this 10 years, we didn't know because we didn't actually have data until we did projects like Prevent. We hypothesized that these diseases didn't start in late life, but they started a lot earlier. And this is very much on the basis that most chronic disorders, cancer, cardiovascular disease, don't happen overnight. They've got a long, what we call prodromal or preclinical period. So with Prevent, what we did deliberately was shift our gaze and say, can we look earlier in the course of disease to see what's happening in people in midlife that may be an expression of early disease in a high-risk population. And this is where you guys come in. Because we could hypothesize, we could draw cartoons, we could have figures, but what we needed to prove this and to provide credible and compelling evidence to various stakeholders and audiences was data. And we needed that partnership with each and every one of you to be able to bring evidence to bear on these discussions. And if I thank the Alzheimer Societies a few times, in my heart, I cannot thank you guys enough for the commitment you've made in this last 10 years to really, really, really changing the world. And I'll show you how that's happened in the next few moments. Because that changing the world that you've helped us to achieve has been not just to develop the science and produce the papers and to train the doctoral fellowship, the PhDs and the postdoctoral fellowships. It's to take that knowledge to policymakers, stakeholders, governments, and say, time is now to maybe take this evidence that we've been generating with your help and your partnership to make a difference to people out there all around the world who are at risk of dementia. Because in doing that, and taking the evidence that you've helped us generate to those policymakers and putting in place prevention clinics, brain health clinics, guess what we do? We prevent dementia. So the key moments, if you like, I could have a list of 100 different conversations that have taken place over the years, but right at the very beginning, I don't know, Catherine, if you remember this, and it's a pity Karen's not here, because we got asked in the interview for the Prevent programme by John Gallagher, I remember it well. John, who's obviously a very dear friend from Dementia Platform UK, asked, I think, a slightly leading question. Why are you going so young? To which Karen, within a nanosecond, replied, we're not going young enough. And that put that to bed straight away. But the other thing that I remember, and again, apologies to colleagues and friends who've heard me say this a million times, but I saw a patient around the same time, 2012, 2013, who came to see me in clinic, and he was in his midlife and he had a strong family history of Alzheimer's dementia. And at the end of all the assessments that we did with him, he asked, quite understandably, what is my risk and what can I do about it? And I said to him, CR, that's me, said, I don't know, and I don't know. And he said, well, we, and I've underlined we, are going to have to fix that. And he's actually a participant in the Prevent Dementia Programme up in Edinburgh. But I think that's really important because the Place de Vosges was where Karen and I had that sort of intellectual discussion and philosophizing about what we should be doing. But this project has in its very DNA, its very first few moments, a conversation with a patient who's in the project. And I'd like to think, and we can always do more, that this has been a partnership between the academics, the researchers, the funders, and most importantly, you as participants. So we are trying to fix this. Not the researchers, not the academics, not the universities, but we collectively are trying to do this together. And of course, the other key moment was when the Alzheimer Society phoned me up and said, you got the grant? Yeah. And then this all happens. So what's happened since 2014? At the moment, we've got 802 people recruited into the project. It includes the original 700 who are in the core Prevent Dementia Programme, but also, as I'm sure you're all aware, we have a sub-study led by Professor Willie Stewart, we'll hear about later, looking at rugby players, former rugby players, and former football players. I had to stop myself saying soccer. I spend so much. I'm actually going to America again tomorrow, and I'm obviously untrained myself to say soccer. But the football study and the rugby study, which we'll hear a little bit about this afternoon as well. I calculated that equates to 1,557 study visits that Katie has overseen. So thank you again, Katie. Which roughly works out, please don't say that's not right, but anyway, roughly works out as 12,456 hours of assessments. I'm sure some of you who have been assessed feel it's been like 1.42 years of assessments. That's the total across the project. and a little bit ghoulish, but it equates to 31.14 litres of blood that we've taken from various people. And as the lab people know, an awful lot more urine is in various freezers around the country. And if anybody wants to analyse that urine, please do call us. So thanks for giving us your blood and your urine and also your saliva. Over 50 publications, and there's been a huge acceleration in number of academic publications over recent years, because as you can understand, the data we gathers much greater value academically as time passes. I'm going to hear a lot about various publications and knowledge which is emerging from Willie and John and others during the course of the day. We've been parenting, if you like, 10 sub-studies, which cover such topics, as you all know, because you've been involved in a lot of these sub-studies: oral health, speech. We've mentioned, of course, the sports study, and various others over the years, which have been incredibly important, and eye imaging, which is another huge project run by Tom McGilvery up in Edinburgh. Calculated that we've had 86 core staff, and that's really quite gratifying as well, that this project's employed people, some really bright people, in universities up and down the country and in Ireland, but scores more on the various sub-studies, working in laboratories and in the MRI facilities. So one could argue there's probably about 200 people who've been employed either directly or indirectly over the course of the 10 years to work on this. And what I didn't mention, which I maybe should have mentioned, was the original grant was an incredible £215,000. But relatively speaking to other projects that you may have read about or heard about, that's actually, again, this hopefully doesn't sound ungrateful, that's actually quite a small number in terms of what we've had to do with that original grant. But we've grown, and that seed, if you like, seed funding, has led to a total of £4 million of funding over the last 10 years. And that's probably an underestimate, because that's only to the core project. That doesn't include all the other sub-studies that have also been funded as a consequence. So I think probably several £1 million of grant funding has been awarded to the Prevent Dementia Programme over this 10 years. So I want to spend a little bit of time on this slide. If you like, prevents children. It's many of you will know the film Yesterday, where the Beatles didn't exist in a multiverse, okay, or Sliding Door, or The Man in the High Castle, and various other sort of multiverse sort of mind games that these films do. And it's almost like the purpose of those films is to imagine a world where something didn't happen and what would have happened as a consequence if there'd been an alternate universe from that sort of multiverse perspective. And for those of you who've seen the film Yesterday, which is about this world where the Beatles never existed, there's actually quite a nice moment in the film where the lead character is talking to Ed Sheeran, who did exist, but there's no Oasis. Maybe this is a generational thing. You don't get Oasis. So I often do this with Prevent, and think, could you imagine a world where that £215,000 grant fund hadn't been awarded? What would not have happened as a consequence of that? But what did happen was another project that started in 2015, which probably would have happened had it not been for Prevent, because it's a huge European Union project involving numerous investigators across Europe and elsewhere. The EPAD project, European Prevention of Alzheimer's Dementia. But I was very fortunate enough to be asked to lead that, and I think it was because of the success of Prevent. Simon Loveston, who many of you will know, who was also in the steering group of Prevent back in the early days, almost put me forward to lead that, probably based on the success and the way we were doing the Prevent programme. So it probably would have happened, maybe even had the same personality or characteristics had it not been for Prevent. The next thing on this sort of timeline was, and as I mentioned in that early cartoon, in 2019, as many of you know, I spoke to the First Minister in Scotland on the basis of the data and the coming out of Prevent and EPAD, and really sort of persuaded her that there's a call for action. The evidence base was probably significant enough to actually start doing something with what we were generating from Prevent, EPAD, and other projects across the world aligned to that. But in many ways, it wasn't just I didn't present her a whole bunch of academic papers. What I actually channeled was the 700 odd conversations that we'd been having with you. What's my risk? What can I do about it? It wasn't necessarily showing her a paper with a table or a chart or a p-value or an academic analysis. It was the narrative that we developed in those several years from working with each and every one of you, from the researchers, from the participants panel, etc., to say the time is now and we should really be doing something about this. And that led to Brain Health Scotland. The final step of the journey is a personal one where I've set up a company, as many of you know, called Scottish Brain Sciences. And if the foundations were set with Prevent and EPAD and the implementation with Brain Health Scotland, then in the last 18 months, I've sought a way to accelerate even further what we've been trying to do. But it's quite, this figure at the bottom, maybe, again, slightly illustrative. But these are, I did a little PubMed search last night when I was doing this. PubMed is an online cataloging system for academic outputs. And I just asked it in many ways, how many brain health related publications have there been about Alzheimer's disease over the last 20 years or so? And you can see this almost exponential rise in global interest in this for prevention space. And the little red arrow, of course, is 2013. That's when Prevent started. Now, I can't claim all responsibility for all of those academic outputs, but I think we have had an influence. Okay. So this is a bit of EPAD, and I'm just not going to go this slide in detail, but you have to understand that EPAD itself was a 64 million euro project, absolutely massive. Again, I think founded very much on the learnings we had from Prevent, which were very influential. And the partnerships with industry and with small and medium-sized enterprises, 2,000 research participants. Some of you are in both projects, I know that. But also now, one of the largest biobanks of CSF, but also now several hundred publications coming out of this sort of sliding door moment. What would have happened had we not had that grant from the Alzheimer's Society? And also, I think one of the really important things that we'll hear more about when we talk about the Next Gen project later today is how we take the knowledge from Prevent and EPAD and globalize it. Because as many people know, the burden of dementia is going to fall most on low and middle income countries. So whatever we learn in the UK and Ireland and across Europe and North America is for nothing if it can't be applied where people need it most, or most people need it, which is in LMICs, low and middle income countries. So this just illustrates how the data from EPAD and indeed Prevent is being used across the world for research purposes. Brain Health Scotland, when it kicked off in 2020, this was our kind of, our purpose was to try and, like I said, change the narrative that neurodegenerative diseases, Alzheimer's disease, were diseases of midlife, that only express themselves later in life as dementia syndrome. So we had to change the way we communicated this, hence picture of a younger woman rather than an older person in terms of talking about these conditions. And also Brain Health Scotland, not Dementia Prevention Scotland. We want to focus on health and optimism. And also not just working in a clinic, but working across society, public health approaches, high-risk groups, people with head injury from, for instance, sports, were our targeted population. So again, none of this would have happened had it not been for Prevent Dementia. And translating that into clinical practice across the world, but certainly I can lay a direct correlation between Prevent and what we're doing up in Scotland, because it's still me. But elsewhere in the world, I think we have had influence on this brain health movement. Now, this is my last slide, the next 10 years, and these are my sort of predictions, if you like, 7 predictions for what I think the next 10 years are going to hold. And we'll come back to this later on in the afternoon. But number 1, I can't see this. So new therapies will be commonplace in the NHS and other health systems. I think we're all super excited about the advent of drugs like donanemab and lecanemab, and we're obviously nervously anticipating what's going to happen in terms of regulatory approvals and such like, but they're coming and they will get here. Okay, we're just going through some teething difficulties with learning how to use these new therapies, but it's inevitable that new therapies will hit the clinics over the next few months and years. But the way we select patients for those studies will evolve also, because like in other branches of medicine, there's very seldom a one-size-fits-all approach to treatment. What you have to understand is each individual's particular biology, particular risk factors, particular subtype of disease. You think of cancer, we don't talk about cancer anymore, we talk about breast cancer and all different subtypes of breast cancer. So that's what's going to happen with neurodegenerative diseases. We're going to get better at understanding those different pathways that different individuals have and be able to have what we call tailored medicine or precision medicine for those individuals. Where does that data come from? Where does that knowledge come from? Projects like Prevent. And we're learning a lot already about the differences between gender, for instance, subtypes of disease, and also how drugs might interact with your genetic code. We're also, of course, opening the door for early detection. So it's all good and well to have therapies for people around the world, but you have to be able to identify those people effectively. And one of the most important breakthroughs, I think, that we're seeing is blood-based biomarkers, blood tests for Alzheimer's disease. And a lot of the samples that you're providing, we're sharing with organizations who are developing these blood tests. So you're actually helping directly in the validation, the creation and the validation of new tests, which will be used around the world. Your samples are in those analyses. So thank you. And because of that, as I mentioned at the beginning, dementia will be very rare. You know, the analogy I like to use is HIV and AIDS. You know, there's still a lot of people in this world who are living with HIV, but they're living with HIV and not developing AIDS. There'll be a lot of people in the world who have Alzheimer's disease, but we will help in such a way that they will never get dementia. And that's all because of you and your contribution. With the work we're doing with sport, which has been obviously a recent move for us over the last 3 or 4 years, we'll have much greater insight, real knowledge, not speculation, not stuff that comes out in the press, not weird, crazy people from, you know, who just like to sort of pontificate about what they think they know about head injury and brain damage and dementia risk. But world-leading experts who are sensible academics who are actually saying, let the data speak, let the knowledge be generated from real data, not from anecdote. And in that, we'll understand and have great insights into brain damage and the consequences of contact sport, which will make the game safer. Rugby and football aren't going to go away. They're going to be here forever, or American football. But what we want to do is help to make them as safe as possible. So the kids playing it, the adults playing it can really enjoy the game with not worrying about the fear of dementia. You'll hear from Laura later on this afternoon about Next Gen, which is as the name suggests, next generation of the Prevent Dementia Programme, which the early career researchers in our group have been pulling together over the last couple of years, and Laura will talk about that. And we're also having, I think, you know, again, from an employer perspective and from a workforce development perspective, we're going to have a lot of people in the UK and Ireland and maybe elsewhere working in the world whose academic careers have been nurtured by being part of the Prevent Dementia Programme. And that's, you know, I think for a lot of the more senior professors in the group, that's a huge privilege to be allowed to help bring forward the next generation of incredible academic leaders with great insight and great passion. And the final thing is that over the next 10 years, I think the world will thank and be so grateful for the time, commitment, passion, hope, and dedication of 802 people who are Prevent. So thank you very much.